Hello lovely people out there, welcome to my YouTube channel and thanks for clicking on this video. हमने प्रीवियस वीडियो लेक्चर में एक इम्पोर्टेंट सीरीज ऑफ लेक्चर स्टार्ट किया है and the name of that particular series was Therapeutic Uses of our Alpha Adrenergic Receptor. In our previous video discussion, हमने एक बहुत ही इम्पोर्टेंट थेराप्यूटिक यूज देखा था of our Alpha Adrenergic Receptor and that was pheochromocytoma. In today's video lecture, once again we are going to study about the therapeutic applications of our alpha adrenergic receptor and आज का जो main focus होगा that will be the use of our alpha adrenergic receptor blocker in a condition that is known as hypertension. But before starting our today's video lecture, let me give you a brief summary कि आज के इस video lecture में हम कौन सी चीजें discuss करने वाले हैं. The very first thing that we are going to discuss is about the revision of therapeutic usage of our alpha adrenergic receptor blocker in the condition known as pheochromocytoma. The second thing that we are going to discuss is about the use of our alpha adrenergic receptor blocker in the treatment of hypertension. आज के इस वीडियो लेक्चर में हम दो नई चीजें पढ़ेंगे. The very first thing is known as a cheese reaction. And the second one is known as clonidine withdrawal. And finally, we are going to study the use of our alpha adrenergic receptor blocker in the condition known as scorpion sting. So without wasting any further time, let us move on to the revision of therapeutic usage of our alpha adrenergic receptor in the condition known as pheochromocytoma. हमने प्रीवियस वीडियो लेक्चर में देखा था कि व्हाट डू वी अंडरस्टैंड बाय द टर्म pheochromocytoma. So pheochromocytoma is nothing but it is actually a tumor of our adrenal medulla. Now जब हम ट्यूमर की बात करते हैं, there can be two types of tumor. The very first type of tumor is known as adrenaline releasing tumor and the second one is known as noradrenaline releasing tumor. हमने लास्ट टाइम देखा था कि ये जो पेशेंट का जो ब्लड प्रेशर होगा वो बहुत ज्यादा हाई होगा. सो इन दिस पर्टिकुलर कंडीशन वी आर गोइंग टू यूज irreversible non-selective alpha adrenergic receptor blocker and one such example is phenoxybenzamine. Even we can use metyrosine as an adjuvant. Then हमने एक important table डिस्कस किया था जहां पे we had adrenaline producing tumor and noradrenaline producing tumor and हमने तीन important questions को answer करने का try किया था. The very first question was, can alpha blocker given alone in the condition of pheochromocytoma? So वहां पे हमने देखा था कि in condition of adrenaline producing tumor we are not supposed to give alpha adrenergic receptor blocker alone. हमने वहां पे डिस्कस किया था कि why alpha adrenergic receptor blocker should not be given alone in the condition of adrenaline producing tumor. उसके लिए we need to understand the Dale's vasomotor reversal and according to our Dale's vasomotor reversal जब हम alpha adrenergic receptor को block करते हैं this adrenaline is going to work purely on our beta 2 adrenergic receptor and उसके वजह से क्या होगा there will be widespread vasodilatory effect and patient का जो blood pressure होगा वो बहुत ज़्यादा fall हो जाएगा. So remember, in case of adrenaline producing tumor, we are not giving alpha adrenergic receptor blocker alone. But in the second type of condition, that is noradrenaline producing tumor, we can consider giving alpha adrenergic receptor blocker alone. Why? Because हमें ये पता है कि जो noradrenaline होता है it is not having any kind of beta 2 adrenergic receptor action. So जब हम alpha 1 adrenergic receptor को ब्लॉक कर देते हैं जो पेशेंट का ब्लड प्रेशर होता है वो एक स्टेबल रेंज पे होता है. So इसीलिए in the condition of noradrenaline producing tumor we can consider giving the patient alpha adrenergic receptor blocker alone. Now in both the condition that is adrenaline producing tumor as well as noradrenaline producing tumor beta blocker alone are contraindicated. वाई? बिकॉज जब हम बीटा एड्रीनर्जिक रिसेप्टर को ब्लॉक कर देंगे, हमें यह पता है कि एड्रीनालिन इज ऑल्सो हैविंग अल्फा 1 एड्रीनर्जिक रिसेप्टर एक्शन as well as our noradrenaline is having alpha 1 adrenergic receptor action. So वहां पे अगर हमने ब्लड वेसल पे बीटा 2 एड्रीनर्जिक रिसेप्टर को ब्लॉक कर दिया, this both the substances can stimulate our alpha 1 adrenergic receptor and उसके वजह से जो पेशेंट का ब्लड प्रेशर होगा वो बहुत ज्यादा इंक्रीज हो जाएगा. So in conditions of both the condition, that is adrenaline producing tumor as well as noradrenaline producing tumor में we are not supposed to give beta adrenergic receptor blocker alone. In both the condition we can consider giving alpha adrenergic receptor blocker as well as beta adrenergic receptor blocker together. So यहाँ पे यही लिखा है कि in the condition of alpha and beta blocker together we can give such kind of drugs in both this particular situation. Now moving on to our next important concept, that is about the concept of hypertension. Now hypertension में we can categorize our hypertension into two main categories. The very first type of hypertension we can consider it as mild to moderate type of hypertension, and the second hypertension can be considered to be a severe hypertension. हमने ये पढ़ा था कि in the condition of mild to moderate type of hypertension we can consider giving the patient selective alpha adrenergic receptor blocker, but in the condition of severe hypertension we give non-selective alpha adrenergic receptor blocker. Now the question is why? So as you can see on your screen, here we are considering blocking only our alpha 1 adrenergic receptor, and in the second figure we can consider blocking our alpha 1 adrenergic receptor as well as our alpha 2 adrenergic receptor. हमें यह पता है कि जब हम ब्लड वेसल पे अल्फा 1 एड्रीनर्जिक रिसेप्टर को स्टिम्युलेट करते हैं, इट विल लीड टू वेजोकंस्ट्रिक्शन. बट जब हम यही अल्फा 1 एड्रीनर्जिक रिसेप्टर को अगर ब्लॉक कर दे, इट विल प्रोड्यूस द अपोजिट इफेक्ट एंड दैट इज वेजोडाइलेटेटरी इफेक्ट. सो जब हम सिर्फ और सिर्फ अल्फा 1 एड्रीनर्जिक रिसेप्टर को ब्लॉक करते हैं, it will produce some kind of vasodilatory effect. But remember, जब अल्फा 2 एड्रीनर्जिक रिसेप्टर पोस्ट साइनेप्टिकली हमारे ब्लड वेसल में प्रेजेंट होते हैं, it is working similar to our alpha 1 adrenergic receptor. So when we give the patient non-selective alpha adrenergic receptor blocker, it is blocking our alpha 1 adrenergic receptor. By blocking this alpha 1 adrenergic receptor, it will produce some kind of vasodilatory effect, and moreover we are also blocking our alpha 2 adrenergic receptor. So उसके वजह से भी there will be additional vasodilatory effect, and जो patient का जो blood pressure होगा by giving non-selective alpha adrenergic receptor blocker ज़्यादा fall होगा. So in short, just remember, in the condition of mild to moderate hypertension, we are giving the patient selective alpha 1 adrenergic receptor blocker. On the other hand, if this hypertension is severe, in that condition we give the patient non-selective alpha adrenergic receptor blocker. Now moving on to our next important concept, that is the use of our alpha blockers in the condition of hypertension. The very first thing that we are going to discuss is about essential hypertension. So in the condition of essential hypertension, selective alpha 1 adrenergic receptor antagonists are preferred in the treatment of mild to moderate hypertension. And जब हम selective alpha 1 adrenergic receptor एंटागोनिस्ट देते हैं पेशेंट को, एक इंपॉर्टेंट साइड इफेक्ट हम अवॉइड कर सकते हैं, एंड दैट इज दे कॉज लेस टैकीकार्डिया. नाउ द क्वेश्चन इज व्हाई. सो एज वी नो कि जो हमारे प्री साइनेप्टिकली एड्रीनर्जिक रिसेप्टर्स प्रेजेंट होते हैं, वी हैव आवर अल्फा 2 एड्रीनर्जिक रिसेप्टर एंड जब यहाँ से नॉरएपिनेफ्रिन विच इज ऑल्सो नोन एज नॉरएड्रेनालिन जब रिलीज होगा साइनेप्स में, दिस नॉरएपिनेफ्रिन इन सम अमाउंट विल वर्क ऑन अवर अल्फा 2 एड्रेनर्जिक रिसेप्टर। एंड हमें ये पता है कि जब हम अल्फा 2 एड्रेनर्जिक रिसेप्टर को स्टिम्युलेट करते हैं, इट विल शो नेगेटिव फीडबैक मैकेनिज्म। उसके वजह से जो रिलीज ऑफ नॉरएपिनेफ्रिन है वो कम हो जाएगी। नाउ जस्ट थिंक कि इफ वी हैव सम काइंड ऑफ ड्रग्स which can block our alpha 2 adrenergic receptor which is present presynaptically, तब क्या होगा? ये जो नॉरएपिनेफ्रिन है will not be able to act on our alpha 2 adrenergic receptor. So जो नेगेटिव फीडबैक मैकेनिज्म है वो हमने ब्लॉक कर दी है। एंड जब हम नेगेटिव फीडबैक मैकेनिज्म को ब्लॉक कर देते हैं, there will be relatively more release of noradrenaline into the synapse. एंड हमें ये पता है कि जब नॉरएपिनेफ्रिन साइनेप्स में आता है, अवर नॉरएपिनेफ्रिन कैन वर्क ऑन अवर बीटा 1 एड्रेनर्जिक रिसेप्टर। एंड हमें ये भी पता है कि जो हमारे बीटा 1 एड्रेनर्जिक रिसेप्टर्स होते हैं, दे आर वेरी वेल कॉन्सेंट्रेटेड ऑन अवर ह्यूमन हार्ट। एंड जब हम बीटा 1 एड्रेनर्जिक रिसेप्टर को ह्यूमन हार्ट पे स्टिम्युलेट करते हैं, इट कैन प्रोड्यूस इंक्रीज इन हार्ट रेट, and that increase in heart rate is known as tachycardia. But when we give the patient selective alpha 1 adrenergic receptor antagonist, तब ये प्रॉब्लम नहीं होती है। Why? Because हमें ये पता है कि when we give the patient selective alpha 1 adrenergic receptor blocker, this selective alpha adrenergic receptor blocker is purely going to work on our alpha 1 adrenergic receptor, and it is not blocking our alpha 2 adrenergic receptor. So जो negative feedback mechanism है वो inhibit नहीं होता है, and that is why whenever we are giving patient selective alpha 1 adrenergic receptor blocker, वहाँ पे they are showing lesser side effects of producing tachycardia. But on the other hand, अगर हम non-selective alpha adrenergic receptor blocker देते हैं, they can block our alpha 2 adrenergic receptor, and उसका एक important side effect है, that is tachycardia. Now moving on to our next important use of alpha adrenergic receptor blocker, that is our alpha blocker can be used in the condition of hypertensive emergencies. So in the condition of hypertensive emergencies, जब पेशेंट का ब्लड प्रेशर बहुत ही ज्यादा राइज हुआ है, वी कैन कंसिडर गिविंग द पेशेंट इंट्रावेनस फेंटोलामीन, बिकॉज इंट्रावेनस फेंटोलामीन कैन शो रैपिड ऑनसेट ऑफ एक्शन। एंड इफ यू कैन रिमेंबर फ्रॉम अवर बेसिक क्लासिफिकेशन, ये जो फेंटोलामीन है दैट इज बिलोंगिंग टू रिवर्सिबल नॉन सिलेक्टिव अल्फा एड्रेनर्जिक रिसेप्टर ब्लॉकर। नाउ ऐसे जो ड्रग्स होते हैं, it can be useful in the following 3 important conditions. The very first condition is to control the hypertension episodes during surgery of pheochromocytoma. Now what is this important point? Now जब हम pheochromocytoma की बात करते थे, वहाँ पे the permanent solution of pheochromocytoma is surgery. So जब हम सर्जरी परफॉर्म करते हैं, there may be increased release of catecholamines, and हमें ये पता है कि जब catecholamines का concentration हमारे बॉडी में बढ़ जाता है, it will increase the blood pressure. So in order to focus, or we can say in order to reduce that blood pressure during the surgery of pheochromocytoma, we can consider giving intravenous phentolamine. So यहाँ पे वही लिखा है, during surgery handling of tumors, it may result in sudden release of large quantity of catecholamines. So we can give phentolamine in order to control the blood pressure. The second important use of our intravenous phentolamine is to control the hypertensive crisis due to Cheezer reaction. Now the question is, what do we understand by Cheezer reaction? So as you can see on your screen, जो हमारे चीज होते हैं, it contains a tyramine. Now the question is, what do we understand by the word tyramine? So जब हमने बेसिक वीडियो लेक्चर पे बात की थी, at that time when we were discussing about the sympathomimetic drugs, हमने sympathomimetic drugs को तीन मेन कैटेगरीज में क्लासिफाई किया था. The very first one was directly acting sympathomimetic drug. The second one was indirectly acting sympathomimetic drug. And the third classification was mixed acting sympathomimetic drug. जब हम indirectly acting sympathomimetic drugs की बात करते थे, at that time I told you कि ये जो indirectly acting sympathomimetic drugs होते हैं, it can again be classified into two main categories. The very first one is reuptake inhibitors, and the example of reuptake inhibitors are our cocaine and tricyclic antidepressants. The second classification was action by displacement, and in that action by displacement हमने एक important drug के बारे में discuss किया था, and that is tyramine. Now the question is, what do we mean by action by displacement? So simply understand कि ये जो tyramine जब हम लेते हैं, it is going to our noradrenaline storage vesicle, and ये वहाँ पे जाने के बाद it will simply push our noradrenaline molecules. उसके वजह से क्या होगा, जो noradrenaline का concentration है वो synapse में बढ़ जाएगा, and हमें ये पता है कि जब noradrenaline का synapse में concentration बढ़ता है, it can work on our alpha 1 as well as beta 1 adrenergic receptor, and उसके वजह से जो ब्लड प्रेशर है वो बढ़ जाएगा. बट नाउ थिंक कि जब हम चीज कंज्यूम करते हैं, डू वी डेवलप हाइपरटेंशन? द आंसर इज नो. नाउ द क्वेश्चन इज, व्हाई बाय कंज्यूमिंग चीज वी आर नॉट डेवलपिंग हाइपरटेंशन? When we consume cheese, it will go into our gastrointestinal tract, and inside our gastrointestinal tract we are having a very important enzyme, and the name of that enzyme is monoamine oxidase. ये monoamine oxidase क्या करता है? It is responsible for the metabolism of our tyramine molecules. So when we are consuming cheese, that cheese is containing tyramine. It will go into our gastrointestinal tract, and जो हमारे monoamine oxidase होंगे वो ये tyramine को destroy कर देंगे. So our tyramine will not show any kind of action. But in some of the patients of depressants, we can give MAO inhibitors. Now जब हम monoamine oxidase inhibitors देते हैं, and if the patient after consuming monoamine oxidase inhibitor is consuming cheese, that cheese will contain tyramine, and ये tyramine GIT के अंदर जाने के बाद it will not be degraded. Why? Because monoamine oxidase को हमने inhibit कर दिया. So now this tyramine molecule will be getting absorbed into our blood, and it will show its effect. And जो synapse में norepinephrine का concentration होगा वो बहुत ज़्यादा बढ़ जाएगा, and this particular condition is known as cheese reaction. So I will just read. When we consume cheese, this tyramine is destroyed by a very important enzyme which is present in the GIT, that is monoamine oxidase. Now in those patients who are on monoamine oxidase inhibitors, this tyramine cannot be broken down, and it will go to our storage vesicle, and from that storage vesicle it will displace our noradrenaline molecules from the nerve ending. So जो patient का blood pressure होगा वो बहुत ज़्यादा बढ़ जाएगा, and in order to control the blood pressure we can give phentolamine, and also we can consider giving tolazolin for this particular usage. Now moving on to our next important use of alpha adrenergic receptor blocker in the condition of hypertensive emergencies. It can be used to control the hypertensive crisis due to clonidine withdrawal. Now the question is, what do we understand by the concept of clonidine withdrawal? The very first thing that we need to understand, ये जो clonidine होता है, that is alpha 2 adrenergic receptor agonist. So we know कि presynaptically we have our alpha 2 adrenergic receptor and by giving clonidine, ये clonidine क्या करते हैं? It will stimulate our alpha 2 adrenergic receptor and as we know कि ये जो clonidine है it is alpha 2 adrenergic receptor agonist. So उसके वजह से क्या होगा? It will stimulate our alpha 2 adrenergic receptor and it will induce the negative feedback mechanism. उसके वजह से जो release of norepinephrine है into the synapse that will be reduced and हमें ये पता है कि ये जो clonidine होता है it can be given in the patients of hypertension. So clonidine reduces the release of noradrenaline and hence it reduces the blood pressure. But when we give clonidine for the long period of time, then we suddenly stop giving clonidine. जो पेशेंट का हाइपरटेंशन है वो बहुत ज्यादा बढ़ जाता है and this increase in hypertension is known as rebound hypertension. We need to discuss why this is happening. So as you can see on your screen, this is the mechanism of action of our clonidine molecules. So clonidine क्या करते हैं? Presynaptically जो alpha 2 adrenergic receptors होते हैं, it will stimulate those alpha 2 adrenergic receptor and उसके वजह से जो noradrenaline का release है that will be reduced. Now हमें ये पता है कि noradrenaline can work on our alpha 1 adrenergic receptor as well as it can work on our beta 1 adrenergic receptor. But as we give clonidine to the patient, ये clonidine क्या करेंगे? अल्फा 2 adrenergic receptor को stimulate करके रखते हैं. So the amount of noradrenaline release is less and अगर कम noradrenaline आएगा, it will stimulate less our alpha 1 as well as beta 1 adrenergic receptor. So क्या होता है जब ये alpha 1 adrenergic receptor and beta 1 adrenergic receptor कम stimulate होते हैं, इनका upregulation होना start हो जाता है. Now what do we mean by upregulation? Simply understand कि upregulation is nothing but it is increase in the number of our alpha 1 and our beta 1 adrenergic receptor. So as you can see in the second figure, जब हम clonidine abruptly stop कर देते हैं after giving it for few months, तब क्या होगा कि ये जो clonidine पहले अल्फा 2 एड्रीनर्जिक रिसेप्टर को स्टिम्युलेट करके रखता था, उसके वजह से जो रिलीज ऑफ नॉरएड्रेनालिन था वो कम हो गया था. बट नाउ एज वी हैव विथड्रॉन दिस पर्टिकुलर ड्रग, नाउ अवर क्लोनिडिन इज नो लॉन्गर एबल टू स्टिम्युलेट अवर अल्फा 2 एड्रीनर्जिक रिसेप्टर. उसके वजह से क्या होगा? रिलेटिवली देयर विल बी मोर रिलीज ऑफ नॉरएड्रेनालिन and अभी हमने बोला था कि upregulation of our alpha 1 as well as beta 1 adrenergic receptor is taking place. So our noradrenaline is now working on more number of alpha 1 and beta 1 adrenergic receptor. And हमें ये पता है कि whenever we are stimulating our alpha 1 and beta 1 adrenergic receptor, जो patient का blood pressure होता है वो बहुत ज़्यादा बढ़ जाएगा. So in this particular condition, we can consider giving phentolamine. So we saw there are three important usage of our alpha adrenergic receptor blocker. In the conditions like we can use this intravenous phentolamine to control the hypertensive episodes during the surgery of pheochromocytoma, to control the hypertensive crisis due to cheese reaction. And lastly, it can be used to control the hypertensive crisis due to clonidine withdrawal. Now moving on to our next important use of our alpha adrenergic receptor blocker, that is in scorpion sting. So what happens during the scorpion sting? जो scorpion का venom होता है, that is acting as a very potent alpha 1 adrenergic receptor agonist. So, हमारे बॉडी में जितने भी हमारे अल्फा एड्रीनर्जिक रिसेप्टर्स प्रेजेंट होते हैं, ये वेनम क्या करेगा? इट विल वेरी स्ट्रांगली stimulate those alpha adrenergic receptor and it can produce widespread manifestations. Now, to avoid the venom to cause the stimulation of our alpha adrenergic receptors, we can consider giving alpha adrenergic receptor blockers. So, हम कौन से ऐसे ड्रग्स देते हैं? We can give prazosin like drugs in the condition of a scorpion sting. So, उससे क्या होगा? जो हमारे अल्फा एड्रीनर्जिक रिसेप्टर्स है वो ब्लॉक हो जाएंगे एंड जो भी स्कॉर्पियन का वेनम होगा that will not be able to stimulate our alpha adrenergic receptor and जो भी harmful manifestations होते थे by stimulating of our alpha 1 adrenergic or we can consider it as alpha adrenergic receptor वो नहीं होंगे. So that's it for today's video lecture. In the next video lecture we are going to see more therapeutic usage of our alpha adrenergic receptor blocker. अगर आपने वीडियो यहाँ तक देख लिया है, please consider subscribing to my YouTube channel. Press that bell icon. Like this video and share it with your friends. See you in the next video. Till then, see ya. Bye bye. Have a good day.